So we want to welcome everyone to our webinar today. Um, our conversation today eight for National Women and Girls HIV and AIDS Awareness Day is Self-Awareness, Know the Facts webinar. So I am LaShonda Wallace. I'm the Executive Director for Seeds of Healing. Seeds of Healing is a HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma and generate support for marginalized people living with or affected by an HIV diagnosis. This webinar is being recorded and will be shared on our Showtime platform and posted to our YouTube channel for you to share with others or return to watch for yourself. As an attendee, you can drop your questions in the chat box. This will be shared at the end of the webinar where we do the Q&A, but these will not be anonymous. If you wish to ask an anonymous question, please use the Q&A feature on your Zoom. Feel welcome to ask questions and write comments throughout the program. So before this webinar begins, allow me to welcome and introduce you to our speaker today. We have the Fawn Rose, and I say the, because I was about to say the Queen. We have Fawn Rose, and it is a delight to have her with us today. Fawn is a Wilmington, North Carolina native. She is passionate about her advocacy for equity and community empowerment. Fawn holds a Bachelor of Science in Behavior and Social Science from North Carolina Central University, and she recently earned her Master of Public Health with a focus on leadership and practice from University of North Carolina's Chapel Hill's Gilling School of Global Health. She is now pursuing her PhD in Global Health Equity at Meharry Medical College's School of Global Health, and as part of their first cohort. She's been inspired by her grandparents' legacy of service. The Rose has built a career marked by leadership and dedication to health equity. She quickly advanced from Advancing Equity Coordinator to Health and Human Services Equity Coordinator for New Hanover County and focuses on reducing disparities in marginalized communities. Fawn's achievements include organizing an annual pop-up grocery store event that has served nearly 1,000 residents during the holidays. Fawn has earned numerous accolades, including her 2022 Health Equity Award from New Hanover County and recognition as one of the Wilma's Woman to Watch in 2023. Rooted in faith and inspired by gospel music and poetry, Fawn is also a dedicated mother, supporting her 16-year-old son, a standout athlete. And when she says stand out, she means stand out. So if any of you had the opportunity to see her son, wow, he does stand out. He's tall. He's very tall. He's also a rising senior at John T. Hargett High School here in Wilmington, while living by the values of service and perseverance. So without further delay, I will turn it over to Fawn Rhodes. Fawn, you got
Thank
it.
you. I thank you, Dr. Wallace. Thank you, Dr. Wallace. I have to update that. So Denzel's a senior now, and he does stand tall. I say he stands out because he's outstanding, and he is 6'9.5". He just got a half inch on us now. So
Mhm.
we I think by the time he graduates, he may be 7 feet. So we'll see how God brings that into fruition. But thank you, everyone. We are going to have a wonderful conversation this evening. I'm going to be presenting to you on hope, health, and healing. This the theme for National Women and Girls HIV/AIDS Awareness Day. Today is National HIV/AIDS Women and Girls HIV/AIDS Awareness Day. So we want to make sure that we take some time to hold space for those that have been impacted by HIV and awareness, HIV and AIDS. So if we'll just give us about a 30-second pause so we can hold space for those that have been impacted by HIV and AIDS. All right, thank you so much for joining me and pausing for those that have been impacted. As I stated, today our discussion is going to be hope, health, and healing, overcoming barriers to HIV/AIDS treatment for women and girls. So let's talk about some history because you can't know where you're going if you don't know where you're coming from. So let's go into some history. So in 1981, the first cases of what would later be identified as HIV were reported. At the time, the virus was primarily associated with men. The virus was leading to a widespread misconception that women were not significantly affected. This male-centered focus shaped early research and definitions, causing the cases of women to be largely overlooked. As a result, stigma and misinformation delayed gender specific healthcare responses, leaving many women undiagnosed or misdiagnosed. Without dedicated advocacy in the early years, women were also left out of initial treatment trials, limiting their access to life saving interventions. These early missteps set the stage for years of disparities in how HIV prevention, care, and treatment were assessed for women. So now we get to the 90s. In 1990s, the impact of HIV on women finally gained recognition, leading to major advancements in diagnosis, treatment, and advocacy. In 1993, the CDC expanded the AIDS definition to include conditions that disproportionately affected women, such as cervical cancer and recurrent vaginal infections. This change meant that more women could receive an accurate diagnosis and access necessary care. A year later, the ACTG 076 trial in 1994 proved that AZT significantly reduced the risk of mother to child HIV transmissions. This breakthrough transformation in prenatal care saved millions of infants worldwide and laid the groundwork for future prevention efforts. Recognizing the unique ways HIV affected women, researchers launched the Women's Interagency HIV/AIDS Study, WIHS, in 1993. One of the first large-scale studies focused exclusively on women. WIHS provided critical data on disease progression, treatment responses, and the social challenges women face when living with HIV. During this time, advocates like Arlene McCurtis worked tirelessly to amplify the voices of Black women affected by HIV. She pushed for better healthcare access, more inclusive research, and policies that address racial disparities in care. Her efforts alongside these key medical advancements helped shape a more equitable and gender-responsive approach to HIV treatment and prevention. We now have a video for you to watch.
Showtime, Josie, you're up.
On Josie Webb's 13th birthday, her aunt gave her a book.
Pick up those eyes and enunciate.
Her aunt gave her a book that changed her life. It was a volume of Maya Angelou poems. After Josie read And Still I Rise, she knew she didn't want to be a ballet dancer or a nurse. She wanted to be a poet.
Stop fidgeting. You are a voice in this world.
So it was a proud day when she graduated from Hillman with a degree in English literature and high honors. That was the spring of 1992. By the following spring, Josie Webb had died of acquired immune deficiency syndrome, the disease we all know as AIDS.
Years later, you'll be lying in a hospital bed with pneumocystis pneumonia and a few years to live.
Nothing like an AIDS board to teach you that youth is not immortality. Youth is a gift. 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 Youth is More than anything, youth is the power to make choices. Now that I'm gone, I ask one thing of you. Remember, always to choose life.
Thank you for your honesty. How long have you known?
Since last summer. I am so sorry that I'm late.
But you're just in time for an F. Sit down. Excuse me, Josie? What's it like? I mean, how do you feel at this?
Some days fine, other days not so fine. I take a lot of medicine. I don't understand. This is not a woman's disease. Tell that to the 16,000 women who have it. They use drugs and they do perverted things.
AIDS is not a moral judgment.
How come she couldn't tell by looking at him? Because you can tell by looking at him. Looking at me, could you tell I was dying?
Girl, she lives right down the hall from me. I gotta change dorms.
Gina, to get AIDS, there has to be an exchange of bodily fluids. That's why people get it from transfusions, needles, sex.
I've never had any of the above. Aren't I mean, you can't get it from kissing.
Well, they're not completely sure, Terrence, but it's highly unlikely.
I want to thank all the women in this room who held out on me.
So that was the 90s. And as you can see in the 90s, the information that we were talking about during that period of time, there was a lot of misinformation, as you can see, in terms of HIV, and a lot of stigma and bias that came along with HIV in the 90s, where people thought that they could just look at you and tell if you had HIV, that that HIV was only for women who were promiscuous, or prostitutes, as Whitley was alluding to, or people who just use drugs, or IV drug users. Those were much of the stigma and bias that came along with HIV. Initially, as we discussed, when HIV first was started, many people thought it was a quote unquote white man's disease. And you could only get it if you could only be impacted or infected by HIV if you were white. But as we saw, and as the data went on, we saw that times was changed. So now we're going into 2000s. So the early 2000s brought major breakthroughs in the fight against HIV, especially for women. The Global Fund, launched in 2002, followed by PEPFAR, in 2003, pouring billions into HIV prevention and treatment. This made care more accessible, especially in low-income countries where women were often hit hardest. At the same time, antiretroviral drugs, or therapy, or also known as ART, became widely available, transforming HIV care. It helped people live longer, healthier lives, and dramatically reduced mother-to-child transmission, giving women more options for safe pregnancies. Research also made something clear: gender-based violence and HIV were deeply connected. Women in abusive relationships faced a much higher risk, shifting the focus toward tackling violence as part of HIV prevention. Meanwhile, scientists explored female-controlled prevention methods like microbicides gels, designed to protect against HIV without a partner's involvement. The early results weren't perfect, but they set the stage for future innovations in women's HIV prevention. And now we have our second video. So in this particular video, we initially see where, oh goodness, Lynn Lynn, what she was doing was she was actually doing an HIV/AIDS campaign, and Joan and oh goodness, the other young lady, what she was doing, they were actually looking at them putting on the condom for and then it turns out that the person, the condom model was William, uh, inside of the video. And then later we fast forward to a scene where Lynn and the other character, that she's being tested. She got upset because her partner asked her to be tested for HIV. And Lynn walks in and said, well, why wouldn't you want to be tested? And she was like, I get tested every 6 months. And Tony says she felt offended for being asked to be tested for HIV. So the point of me using these videos is because of the context of the times. As we are looking, as the advancements and the conversations was being held around these times, you'll see that it was being integrated into the culture of the times. We'll notice that the first video clip came from a TV show called A Different World. In the 90s, in the early 90s, or I would say leaving out of the 80s, going into the early 90s, A Different World was a very popular television show. And it came on NBC, and it was also one of the focuses, or the main focus, was Black college students, or a historically Black college and university. It was a fictional college and university, which was called Hillman. And so the way that it was integrated into the show was Denise from A Cosby Show actually went off to go to Hillman College, which was also the alma mater of her mother, Claire Huxtable, and her father, Cliff Huxtable. So they both went to Hillman. And so we see Denise going off to Hillman, and so they built a TV show around that. Why is that important? During the 90s, you would see that there actually became a spike in HIV in terms of college campuses, and specifically within the HBCU space. So it was awesome to see that A Different World was actually addressing this conversation and addressing it head on, and with a youth involved, and having that conversation about what HIV looked like, the experience of someone who was dealing with HIV during those particular times. So it was on par with what was happening in the culture at that time. I specifically remember being in college when this particular episode showed up. So it was definitely culturally relative around that time. Then we fast forward to the 2000s, and the TV show at that particular time was Girlfriends. Many of us, and that again, that was on par with my age group. That was on par with my particular age group. And it talked about Girlfriends were 4 girls, or was it 4 or 5? I think it was 5 ladies who were extremely, no, 4, 5, I can't remember. But they were very, very close friends with each other. They shared all their information and talked about what they were, their personal lives, careers. Some of them, 2 of them were friends from very little. Others they picked up, as far as life was going on. But one of the topics that was being discussed was actually HIV, and the stigma that came along with it. Especially when they were 4, with the exception of 1. 4 single women, 3 single women, and 1 that was married, in Los Angeles, and they were living what we would call their best life. Joan was moving up inside of her career as far as an attorney is concerned. Lynn was still trying to find her life and what she wanted to do. Tony was trying to make the rounds of being an exclusive realtor to the realtor of the stars. And then we had Maya, who was a single mom who was experiencing a difficult marriage, and she wasn't happy with it. So there was some infidelity in that space in terms of what their marriage would look like. However, what is relevant about that is because, again, that was on par with what was happening in the culture. You had Black women that were leaving college and going directly into the workforce, and they had their sister circles that they would be having these conversations with on a regular basis about sex and all the taboos of sex. Back in the day, there were certain certain conversations that you didn't want to have so much. But these days, these conversations that they were having were completely different. The young women of that 2000s era, they were bold, they were fearless. You know, they wore what they wanted to, they slept with who they wanted to sleep when they wanted to sleep. We also saw around the 2000s more people having that discussion, and what someone would say coming out the closet, quote unquote. But more people were feeling more free in terms of expressing that I'm lesbian or I'm bisexual, or what their sexuality, how they identified in terms of their sexuality around that particular time. So we started having more and more conversations early around 2000s. And we also saw the terminology of the down low brother, if you all remember that. Around, I know Oprah, she had this man on that actually had wrote this book all about being on the down low. Toni Morrison was on. No, not Toni Morrison. What's the lady how Stella got a groove pack? She wrote a book, and she talked all about how her boyfriend had deceived her, and how she thought that her well, at the time she had married him, and she felt that the reason why he married her was because he wanted a green card, and he got over here and supposedly, you know, turned gay. That was her statement that she said on the Oprah show. So around this culture and around this time, there was more sexual freedom and more liberation, I guess you could say, about what was happening in the culture and how people were experiencing life. You had Salt and Pepper having conversations in the 90s, their songs Let's Talk About Sex. That was another conversation. Then you had the Brand Nubian group, and they was talking about, you know, wearing a condom, you know, wearing a Jimmy hat. That was a quote they used to say, you know, always put your Jimmy hat on when you were going out. So it was culturally relevant, culturally specific, and how they were addressing it. I remember Brand Nubian having a song come out talking about slow down, and just talking about how she was going so fast and she was sleeping around everyone. They said she looked around and she looked like she was getting sick, and it turned out that she had AIDS. MC Lyte, she actually also did a song called Poor Georgie. Poor Georgie, and the lyrics of that, she also talked about him being diagnosed with HIV, or being diagnosed with AIDS. So it was really relevant. We had a lot of culture that was having these conversations about what was happening and what was going on in the world, and there was not asthma, there was stigma. So let's be clear, there was stigma and there was bias. But I would dare say that during those particular times, people were more open and more listening, because it was so ingrained in a lot of the culture that was being put out. So people were more aware about making sure that they get tested on a regular basis. I know when I went to North Carolina Central, the freshman orientation, they specifically made a point to let us know in Durham, North Carolina in 1990 what the numbers were for HIV prevalence in that particular time and how it was impacting those on our campus. And they strongly encouraged us to go visit our health center to be tested on a regular basis. And it was at that time that I started getting tested for HIV and AIDS at my well woman's exams every year since that time. So it was very, very relevant. As I stated, in the 90s, the impact of HIV on women finally gained a lot of recognition, leading to major advancements in diagnosis and treatment and advocacy. And then in 1993, the CDC expanded the AIDS definition to include conditions that disproportionately affected women. And as I already stated, that this change meant that more women would receive accurate diagnosis and access to care. So what we see now, so where are we as far as our numbers are concerned when we're looking at 2025? So when we're looking at our numbers in terms of 2025, Black or African American residents consistently have a much higher incidence rate than white residents, meaning that a larger portion of their population is being diagnosed with HIV each year. This incidence rate for Black and African Americans has fluctuated a lot, with sharp increases and decreases over the years. For example, there's a big spike in 2021, if you're looking at the graph that's on the screen, followed by a dramatic drop in 2022, and then another increase in 2023. This graph tells us that while HIV affects all racial groups, it's disproportionately impacting Black African American residents in New Hanover County. It's a reminder of why equitable healthcare, education, and support services are essential in addressing HIV prevention and treatment. So, in summary, and when we're talking about HIV and we're talking about HIV and AIDS, we really want to highlight the importance of the fact that it still is it still is an issue that needs to be addressed. HIV and AIDS at this time, one of the positives is moved more towards to be diagnosed as a chronic disease versus back in the day it's still a virus. So don't get me wrong. In terms of the science of it, it is a virus. But now we're seeing the life expectancy drastically going further. People are living with HIV longer than they had before. The diagnosis in the past, it would be what people would call, if you got HIV, they immediately thought it would be a death sentence. And that is not so, especially if you stay on your medications. If you get plugged into care, go to your doctors on a regular basis, or stay compliant with your medical appointments, stay involved as far as your medication is concerned. That is going to extend your life longer. Conversations I've had with other medical providers, it says that you have a higher chance of possibly passing away from diabetes than you do of HIV. Now, we do have a doctor here, Dr. Wallace, who can correct me if I'm giving misinformation. But the point is that you have a longer life with HIV and AIDS at this point in time. But the biggest part of this is that you have to remain in care. We are seeing, when it comes to our Black population, less and less that are accessing care for a variety of reasons. We don't want to be presumptuous to say why people are not accessing care in the way that we are hoping that they should. The barriers that are there, we do know about different types of barriers that people experience, but the goal is to get people plugged into care so they can receive equitable treatment when it comes to their health care. And when we talk about equitable treatment, just making that relevant and real for people, we're just talking about a fair and just opportunity for everyone to have health care by their own standards and their needs. So that's what we mean when we say equitable. I always like to give a definition in the sense that equality is population-centered, equity is person-centered. So that means that you get to determine what your needs are when you're having that conversation. We also want to make sure that we highlight bodily autonomy. So making sure that you have the opportunity to have a conversation with your healthcare provider. Healthcare providers have gone to school for a very long time, and they have a lot of information. So we do not want to dismiss the education and the time and effort that they have put in. But you know your body. Only you have been living in your body for as long as you've been living in it. So when something isn't going right, you have the right to let your doctor know this does not feel right, or I've been feeling this particular way. And if you get put on another medication or on a medication and you don't feel this addressing you, you still need to speak up and say, this is not making me feel the way that I thought it was supposed to make me feel. So have that conversation, develop a relationship with your doctor. Don't let it just be a one-sided conversation where you go in to see your physician and they're telling you all this information and you're taking it, and when you leave, you have no idea what they told you. You're just going along with the get along. What you need to make sure that what you're doing is push back. Have a conversation. Say, you know what? I really don't understand what you're talking about. And it's okay to say that. They don't expect you to know. They don't need, sometimes there are times where I've visited my doctor before, they didn't even know a new medication was on the market. So take that time to let them do the education while you are having that conversation and building a relationship with each other together. How about you learn together? How about you make an appointment with each other and you all take that time to say, let's learn about this particular thing together and walk your way through. That way, that's developing relationship with each other, and through relationship, it builds what? Trust. You cannot have trust without having a relationship at all. So you've got to spend some time. And then I also like to say, do a speed dating of different physicians. Don't just make an appointment with the first one to stay there. You may not like them. They may not like you. So, and, and that's real. We're humans, right? So what you need to do is find you a couple doctors that you can find you a couple doctors that you feel that you want to go see. And then as you find you a couple doctors that you want to see, just kind of meet and greet with them and see how things will go. Don't get into the deep blue sea of all the health issues that you have at that particular time, but just go in just like you are doing an interview for them. You said, I'm just coming here to see if if things are work. And then you find the one that actually works best for you, that's going to meet your needs. And then that's where you start. It starts a relationship building. It is okay. If you have health insurance, you can go see a different doctor, several different doctors in 1 month. So you can find, or several different doctors, so you can find the one that's going to best meet your match. So I see a question in the chat. So in terms of the diagnosis rate for as far as HIV among Black women between 2021 and 2022, what we're noticing around that particular time is that as we were coming, well, I'm gonna ask you all, what is the big thing that happened in 2021? You can put it in the chat if you know what something major that happened internationally or globally in 2021. I'm gonna give you 3 seconds to put it in the chat, something that happened in 2021 globally. COVID, absolutely. That happened in 2021. As we were coming out of, as we were coming out of COVID, we started seeing a spike in our HIV rates. And that had a lot to do with people being isolated, being at home. And so as people were being isolated and at home, they were fraternizing and getting to know each other a little bit more during those particular times. But some felt the need that they didn't want to protect themselves. Others could have been in violent situations, because we also have to remember that during that time, sometimes going to work or going to school or being outside of a house was a safe haven for them, leaving that house. And now they're being isolated and confined back to a house where domestic violence may be inside, or interpersonal or interpartner violence, was there in that home. So, and as we learned that domestic violence and HIV were definitely correlated with each other at one point in time. So we're seeing that we saw that spike as we were coming out of COVID, coming into 2022, 2023. They're still getting the numbers. So also want to point out, when you're looking at data traditionally is usually 2 years behind. So 2025, you're going to be looking at data for 2023. 2023, you're going to be looking at data for 2021. There's really no real time that you can actually capture data in that moment. And, as far as data studies is concerned, that will be comprehensively and reflective of a whole national population, because that's just really challenging for that information to get uploaded. So typically, when it comes to population sizes, like of a North Carolina or South Carolina, or even when we're talking about nationwide, that data usually is going to be at least 2 years old, but it's still an accurate reflection of the population that we're talking about. So that is something that we saw, like I said, between 2021 to 2022, we saw a spike in HIV numbers in terms of Black women, and it definitely had a direct correlation to COVID-19 at that time. We're going to start seeing that COVID-19 actually impacted many different chronic disease areas as we're moving forward. If you have any questions, you can drop them in your Q&A box at the bottom, so we can get those questions answered for you at that time. We also, when we're talking about one of the reasons why there was a spike at that particular time, we also want to take a look at, since people were isolated, did that mean that they had the ability to go out? grocery stores shut down, pharmacies shut down. So a lot of people were doing more home deliveries in terms of grocery stores. Me, yeah, I'm still addicted to home delivery. I would have everything delivered if I can, in my personal space. But what does that also mean? That means that a lot less people were actually using over the counter sexual prevention methods at that particular time. So your condoms that you would typically purchase from the grocery store or maybe from the pharmacy or wherever that you would go, then you saw that those were not being purchased. One, who wants to, have Instacart deliver you some condoms? I mean, I know I personally don't, but probably other people probably felt the same way. Putting condoms on your Walmart list. I doubt that very seriously to be delivered to your home. So, you're looking at that from that perspective is, again, all of these things are happening during this particular time, which is actually causing, as I stated, the rate to go up. And as we're looking at HIV and AIDS in terms of Black women. So we also can look at clinical care. Often many studies are concerned, studies that are released, Black women are not included when we come to clinical care or clinical studies. We are getting more involved, but you can actually understand why. When it comes to clinical trials and clinical testing, there's a historical trauma that comes along with that because of many of the trauma that from the Tuskegee trial to the eugenics of here, North Carolina, to Henrietta Lacks and her genes being being stolen, excuse me. So there's so many different situations where Black women and Black populations in general have not been treated properly when it comes to healthcare. So it creates a barrier of mistrust and misinformation. So any things that are being said, then people tend to run with it. I also know that around that COVID-19, we had a lot of celebrities that were going online and making various tweets about what was happening in that space. So you're getting misinformation from those that you're following when it comes to healthcare. So that also causes people to not necessarily be compliant with their health information, especially since we're seeing that as our population is growing, they are actually becoming more and more influenced, which is why we have social influences or media influences. They're becoming more and more influenced by those social media accounts that don't always necessarily have the degrees to back that information up. And not even just the degrees, but just the expertise, because you don't have to have a degree in order to be an expert in what you're talking about, but you should have some legs in the game and been in that space for a long time, working in that space, know that space in order for you to be able to speak about a particular topic. So these are some of the reasons why we're looking at higher amounts of Black women being diagnosed with HIV and AIDS during that particular time. Yeah, it's exactly. I do too. I hear misinformation from many of these social media influencers. And also, I would also say Google is not your doctor. So it's good to get information, to kind of have a foundation to build on. But Dr. Google doesn't know everything. So please understand that. Dr. Google can lead you down the wrong path. Excuse me, that's me being too anxious and speaking. But Dr. Google can lead you down the wrong path. If you're like me, Dr. Google can amplify your anxiety and make you think something that you don't have. So be mindful of checking Google when it comes to health issues. I would always encourage you to get into care. Find you a primary care physician. The emergency room is not your primary care. The urgent care is not your primary care. Find you a primary care physician and get plugged in. If you are in a space where you don't have a culturally, in our world, we say culturally concordant, which means someone who looks like you. So if you're in a space and you don't have as many physicians that may look like you when you go to the doctor, go anyway and develop a relationship with that person, because I'd rather you have a relationship with somebody than a relationship with nobody, if that makes sense. Because sometimes it's not always about finding someone that looks like you, but it's about finding someone that cares about you. So because I've had many a white physician that cares deeply about me and has advocated for me and helped me get the services that I need, because where I live is a predominantly white community. So that means I don't have a lot of Black providers in my area. So I want you to be mindful of that. It's important to have culturally concordant care or people who look like you, because it makes us feel better. We have better conversations. They understand certain things. We don't always have to explain everything. There's a saying that says what's understood doesn't have to be explained. And that really works well when, especially when we're talking about cultural and ethnic groups. However, sometimes that is not always the case. So in those cases, go for someone that you can find that truly cares about you and cares about your health, and they are plugged in. They're not afraid to have those hard conversations with each other and build a relationship with each other and travel along with you. My son's pediatrician is a white pediatrician, and he has been with my son since the moment he came out the womb. and I will tell you that he has been such a joy to work with all the time. But he built relationship with us and he cared about us. So that's what I'm encouraging. If you can find someone culturally concordant, then that's great. But if you cannot, build a relationship with someone and stay into care with a primary care physician or a nurse practitioner, because we also see that many of our NPs, our nurse practitioners, are actually, or family nurse practitioner, are administrating care for many of our populations when there's not a provider there. Get plugged into telehealth if you're not able to actually get in to see someone physically on a regular basis. At least get plugged into telehealth and have a conversation. If you don't know how to use telehealth, get someone to show you how to use your devices and to download the hospital app or the medical app onto your phone, and whatever device that you're using, and do not be afraid to use telehealth in order for you to be able to stay into care with somebody. So the biggest thing is making sure that you're connected to someone that's going to help manage your health so you can have a fair and just opportunity to have a life that is fulfilled. So this is all that I have for you today. I'm going to turn the floor back over to Dr. Wallace. And yeah, thank you, Dr.
Well,
Wallace.
thank you, Fawn. As usual, you always come with a breath of knowledge, and we definitely appreciate you taking us from the beginning of when we first learned about this epidemic, as well as the misperceptions that people had that there were only particular groups that were impacted, and some people, they they stood unattended to until we learned more, and now fighting for just and fair treatment is the way to go. And so thank you for bringing all of that together for us, advocating for those who are vulnerable and those who have been impacted. We appreciate you.
You're most welcome. I want to leave the those who are watching with one final thing. Right now in today's time where we are, we're noticing that a lot of things are very political. Do not get caught up in all of that. As my friend, a very close friend of mine, she said, pivot, don't panic. And what you want to do is make sure that you are taking care of you. That's the biggest thing. Don't get caught up in what's happening on the news, what executive order got pushed through, or who's being pushed out here as far as different agencies and leading those things. You need to make sure that you're taking care of you. And now more than ever, grassroots organizations need to come together and making sure that they are looking at what's happening locally and advocate for you and for your group, your population group, and show up so your voices can be heard.
Thank you. Thank you, Fawn.
Mhm.
Okay. All right. I think that's it. Fawn, do you have any last words?
I appreciate you all for allowing me this opportunity to have a conversation with you about HIV. It's so important that we still fight the fight about stigma and bias, and but continue to move everything forward and not be in a negative space. We're in a positive space now in terms of the advancements as far as health is concerned and medicine is concerned, but we need to make sure that we get everyone plugged in. So thank you again for this opportunity. I so appreciate working with you, Dr. Wallace and Benita. It's always a pleasure.
Thank you. Thank you again for being here. All right. Thank you, Liz. And we want to thank our participants who joined us today. All right, everyone have a wonderful, wonderful evening.